As many as 40% of American adults have a snoring problem. Snoring can have serious impact on your health, your relationships, and your quality of life. There are many products available to resolve this problem, but are they effective? Dr. Peter Michelson discusses the causes of snoring and the range of treatments, including the mandibular repositioning device known as an MRD.
Snoring and sleep apnea are all about obstruction. Snoring is typically some obstruction in the airway where there's a sound that you can hear, sometimes very debilitating to bed partner of the patient. When you go further with that and you start to get actual collapse of the airway, that's when you can start getting obstructive sleep apnea. So the successful treatments for either snoring or sleep apnea depends on successfully treating the area that's obstructing or having resistance. Whether that's the nasal airway, whether that's the oral cavity or tongue base or the throat, each of those locations have their own successful devices and or treatment options. The mandibular repositioning devices are very successful. They have decades and decades of research and literature behind them. They're often a nice alternative to CPAP or the breathing device that will keep your airway stented open. A lot of patients have difficulty with that if they're claustrophobic or they toss and turn when they sleep, or even just the generalized feeling of having a contraption on their nose or mouth. The mandibular devices can play a crucial role in just changing the anatomy of the oral cavity, moving the tongue a certain way, moving the lower jaw a certain way to give the opening of that airway just enough to decrease snoring and to help overall health and to improve your sleep.
Dr. Robert Merrill from the UCLA School of Dentistry discusses how the mandibular repositioning device helps with snoring.
What the MRD does, it's an upper and lower appliance, and those appliances are connected. So the MRD device brings the jaw forward, and when the lower jaw comes forward, the tongue comes with it, and then that helps to open the throat so that air can get through. We're doing research at UCLA as part of our sleep program, the dental sleep program there. And one of the studies that we're doing is looking at changes in the brain, good changes in the brain that are brought about by using one of these MRD devices. These areas of the brain that seem to be heavily impacted by the lower oxygen saturation during the sleep apneic events. There's another study that we're doing at UCLA where we're looking at how bringing the tongue forward with that MRD device can actually open physically open that airway so that more air will flow through, and we can relate the benefit of that to the degree of the opening of that airway.
Dr. Michelson reveals the results of his research on products for stopping snoring.
So I started this project which actually turned into a paper that was in a peer-reviewed journal and published, where I compared some of the most common devices that I saw out there, and I compared them with both subjective and objective instrumentation. One of the products was a lubricating device. It was a lubricating spray that was designed to lubricate the back of the throat and decrease snoring. Then there were the nasal strips that you would put on your nose, and which can open up the external nasal valve and as that company claimed, decrease snoring and mild sleep apnea. And then the third was a pillow that would change your neck positioning during sleep. I obtained those products. I obtained a patient population that wanted to be involved in the study, and then I had them use the devices, and I had them fill out both subjective questionnaires, and then I also used a validated home sleep test called the SNAP test, which is actually still in use today. When I crunched all the data and looked at everything, nothing worked. I also saw some dangers in patients trying to treat themselves. In other words, if your body is telling you something, if you're snoring and you're having difficulties, it can be the sign of something more, such as sleep apnea. And what I wanted to get out there was the importance of the proper medical evaluation and also the importance of not falling prey to, in other words, caveat emptor, buyer beware. Understand what you're buying. Up to 25% of patients that have significant snoring, some of the obstructions in their nose. And in addition to that, some patients have difficulty using CPAP or nasal devices because of a deviated septum, or the tissues in the nose are very swollen or crooked. So an ear, nose, and throat physician with a good examination can often and sometimes will offer a surgery at the start, before you're actually offered an MRD or CPAP, to correct very deviated or abnormal anatomy so that we can start at ground zero.
When we come back, we'll see how snoring affects your health and your relationships. Clinical psychologist Dr. Wendy Troxel specializes in sleep medicine. She reveals the extent that snoring can affect a relationship.
My research focuses on how sleep is a shared behavior among couples, and how disorders like snoring or other types of sleep-disordered breathing can really have a negative impact on the health and functioning of both individual members, but also on the health of the relationship. We know that sleep loss is directly associated with key factors that are critically important for relationships. Things like our ability to regulate our moods, our likelihood of having depression or irritability, our ability to problem solve well, or to read another person's emotions. These are all skills that are critically important in the context of relationships.
Couples need to work together to get a good night's sleep.
Couples need to recognize that snoring is a we problem. It's affecting both of you. And the first strategy and the most important thing is to first find out if there is some underlying medical cause that should be treated, because snoring often goes hand in hand with sleep apnea, which is a clinical sleep disorder, and it's associated with a number of negative health consequences, including increased risk for heart disease. So as a partner, you can be a major supporter of the health of your spouse.
Noel Lindsay outlines the criteria someone should consider to find a device to control their snoring.
Custom devices available from dentists to treat snoring are ideal, but they cost $2,000 to $4,000, and that's after insurance. Fortunately, for a small fraction of that price, you can get a device that you can fit to your own teeth, like an athletic mouth guard. Years ago, we were the only ones who had such a device. But now there are dozens of them, so how do you know which one to get? Well, if comfort is your top priority, you should try to get something that's not too bulky, and you should avoid components that protrude outward that might irritate the inside of your cheek, even if that means that you don't get a device that is adjustable after the initial fitting process. If you're prone to gagging, avoid devices that hold down the back of your tongue. If you want to avoid BPA, only buy a device that is advertised as being BPA free. If you have an overbite or an underbite, make sure you get one that can accommodate you. Once you've picked a device that's right for you, give yourself 3 or 4 full nights of use in order to get acclimated. During that time, your teeth may feel a bit sore, but then it should be really comfortable. If you can't get acclimated to using this type of a device, there are some other solutions that may work for you, such as EPAP or tongue retention devices. Either way, you find something that really works for you, it'll change your life.
Dr. Peter Michelson gives some important advice to people who snore.
What it comes down to is obtaining a treatment that is designed for you by your provider. And once again, that starts with an adequate exam. Understanding your health and general nutrition. Understanding that this is not just a symptom, this is not just a sound at night that upsets your spouse. If this is a sign of something more, you can have hypertension, you can have issues with worsened diabetes, you can have problems with obesity, you can have problems with pulmonary hypertension, you can have all these other medical problems that are from the source of sleep apnea and obstructed breathing. So go to your provider and get a good examination, and we can go from there.